This segment is sponsored by Madarva at Stony Point Surgery Center.
Difficulty breathing isn't something that you simply have to live with, and while a nose job, as it's come to be called, may not be the first solution that you think of, it can be a problem solver. Ear, nose, and throat surgeon Dr. Travis Shaw specializes in facial plastic surgery. He joins us this morning. Dr. Shaw, it's nice to see you.
Nice to see you.
We were talking a little bit before we were on about some of the many things that you do. The area of specialty is facial plastic surgery.
Correct.
And what does that mean?
Yeah. Specifically, as a ear, nose, and throat surgeon, when we're in our training, about a quarter of our training is dedicated to facial plastic and reconstructive surgery, which in essence means taking parts of the face, the things that you think of, whether it's the eyes, the nose, ears, and making whether it's a structural change or a cosmetic change in that. So just as a general plastic surgeon specializes in other parts of the body, we also specialize in other parts of the face, like sinuses, sinus issues, ears, throat disorders, and things like that. So as a facial plastic surgeon, we really turn our focus in on just areas of the face exclusively.
A lot of times with plastic surgery, you may have a tendency to first think, well, this is elective. It's just something that you choose to do. But we're here talking today specifically about, as it's come to be called, the nose job, and why a lot of times that can resolve breathing issues.
Correct. Yeah, most people, when they hear the name rhinoplasty or nose job, automatically think, well, is someone doing something to change the appearance of their nose? But nasal surgery and rhinoplasty specifically can be done to correct breathing disorders, things that might have happened from a congenital defect from birth. For example, children who have cleft lip and palate also often have a mal-shaped nose. So we do procedures on that to try to give them a normal and functioning nose. Other patients have a portion of their nose that may be blocked from whether it's a birth defect, something they've always had, or they've sustained an injury at some point in their life. The nose is one of the most commonly broken bones in the body, and that can result down the line as things heal up in blocked breathing passages or other difficulty breathing. And so a rhinoplasty, a nose job, or other nasal surgeries can be used to address those problems in patients, along with the cosmetic or changing the appearance part of the operation as well.
How do you know if you have a breathing issue or you're having this difficulty breathing? Are there telltale signs before folks would come in and see you?
There are. You know, sometimes it could be the bed partner who's giving you the elbow in the ribs
the elbow
in the middle
maneuver,
of the
yes.
night. Yeah, wake up, honey, you're snoring, things like that. People sometimes when they lay down, their nose tends to get blocked off then, so that can contribute to snoring and sleep disorders and things like that. People who don't feel well rested when they wake up in the morning, a lot of times that can be a nasal breathing issue that we can address possibly by surgery or medications or other methods. Other patients, they may not feel like they can exercise like they would like to. Their exercise tolerance isn't where it is because they feel like they don't get enough airflow through their nose. So those are all the people who generally come in and see us. They might have tried some medications over the counter. They might have seen their primary care physician about the problem, but they just don't feel like their breathing has really gotten to where they would like it to be.
And it may be a situation where you've never broken your nose and you don't necessarily feel that there's a deformity. You know, structurally you're looking okay, but you still could have issues.
Exactly, and that's one of the unique things that we do as ENT and facial plastic surgeons is when we talk about the nose or we think about the nose, we really think about structural issues and what's going on inside of the nose. Some of the technology that we use, we have some very small video cameras that we can actually look inside the nasal passages. We can look into the areas where the sinuses drain into the nose. You can see it right up on a screen. We oftentimes will show that to the patient and say, well, here's the area where the blockage is in your nose. If you were just looking at the outside of the nose, you may never realize that you had that sort of thing.
Absolutely.
So we really try to take a really good look at not only what's going on with the shape of the nose, and if there is a cosmetic concern, the changes that someone might want to make, but what's going on inside and how that's affecting someone's breathing or their breathing patterns.
And we mentioned earlier, you know, there's this thought process that it's elective, but when it is something that needs to be done, oftentimes insurance will cover these things.
That's correct. It depends on the extent of the deformity and how it affects someone's life, but there are many insurance payers who will cover the cost of the rhinoplasty or any nasal operation, depending on the severity of the problems and whether or not they've had an adequate workup, they've tried medications and have failed those medications and things like that. But yeah, you're exactly right.
And when you come in for the procedure, what can folks expect and how long does it take to recover?
Yeah. if patients come in and see us, well, the first thing I always discuss with patients is what is it about their breathing that they don't like. And like we mentioned before, sometimes it is the bed partner who's told them they need to go see someone. But we do a thorough examination inside and out of the nose, talk about any changes that the patient would like to make. If they want to make a change in some part of their appearance, we can often do that at the same time during a functional nasal surgery. We can make cosmetic changes at the same time. Obviously, insurance won't pay for that part, but it's the kind of thing you could do in one shot when you came into the surgery center to have the procedure done. The procedure itself in general takes about 2 hours. You're completely asleep for the entire procedure. You don't feel anything. The recovery, everyone's a little bit different. The most important thing that I tell people afterwards is that for the first 2 to 3 weeks after the surgery, you're not going to breathe very well through your nose. So you're going to feel disappointed that you underwent this surgery. But after that 2 to 3 week period and the swelling subsides, the overwhelming majority of patients feel like they're breathing much better.
Right.
It's not a terrible recovery to have to undergo. It's outpatient surgery. In other words, patients get to go home the same day. They can recover in the comfort of their own home with their families. I usually see patients 4 to 5 days afterwards, just as a routine check on them then. Most patients use pain medication for 1 to 2 days afterwards. Some patients don't even need any pain medication. Tylenol takes care of it, and they do very, very well.
Well, Dr. Travis Shaw, thanks for sharing with us today.
Thank
we
you.
appreciate it.
Thanks.
And you can learn more about facial plastic surgery and how it might be able to help you by contacting Dr. Shaw at 775-4559 or head over to their website, richmondface.com.